Leflunomide is a medication used to treat rheumatoid arthritis, a condition where the body's immune system mistakenly attacks the healthy tissues around the joints. This medication helps to reduce joint damage, pain, and swelling, allowing for better movement. It works by weakening the immune system and decreasing inflammation. It is important to take this medication as directed by your doctor. The usual daily dosage is typically once a day, and it is best to take it at the same time each day. Be sure to follow your doctor's instructions for the best results. When taking leflunomide, you can take it with or without food, as directed by your doctor, usually once daily. It's important to follow your doctor's instructions exactly. You may be instructed to take a higher dose for the first 3 days of treatment. The dosage of leflunomide is based on your medical condition and how you respond to the treatment. It's important to take this medication regularly to get the most benefit from it. To help you remember, try to take it at the same time each day. After you stop treatment with leflunomide, your doctor may give you a different drug, called cholestyramine, to help remove leflunomide from your body. This is especially important if you are planning to have children, or if you are experiencing severe side effects. Without this procedure, the drug may stay in your body for up to 2 years. Be sure to consult your doctor or pharmacist for more details. And don't forget to tell your doctor if your symptoms persist or get worse. Some common side effects include diarrhea, nausea, and dizziness. However, many people using this medication do not have serious side effects. It's important to tell your doctor right away if you experience any serious side effects, such as cough, numbness/tingling of hands/feet, hair loss, chest pain, fast/pounding heartbeat, increased thirst/urination, muscle cramp/pain, mental/mood changes, vision changes, easy bruising/bleeding, unusual growths/lumps, unexplained weight loss, or unusual tiredness. Leflunomide may also raise your blood pressure, so it's important to check it regularly and let your doctor know if the results are high. Additionally, this medication may lower your ability to fight infections, so be aware that you may be more likely to get a serious infection or make any infection you have worse. If you notice any signs of infection, such as a sore throat that doesn't go away, fever, swollen lymph nodes, or chills, seek medical help right away. While a serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Leflunomide can also commonly cause a mild rash, so be sure to seek medical help right away if you develop any rash. This is not a complete list of possible side effects. If you notice other effects not listed above, it's important to contact your doctor or pharmacist. It's important to note that leflunomide should not be used during pregnancy as it may cause serious harm to an unborn baby. Women of childbearing age should have a negative pregnancy test before starting this medication, and they should also use reliable forms of birth control before, during, and after stopping the medication until they have finished taking another drug that helps remove the leflunomide from their body. If there is any chance of pregnancy, it's important to inform your doctor right away. Additionally, it's important to be aware that this drug may rarely cause serious liver disease, with most cases occurring within 6 months of taking the medication. If you already have liver disease, such as hepatitis B or C, leflunomide should not be used. It's important to have periodic liver function tests while taking leflunomide, and to notify your doctor if you experience symptoms such as nausea, vomiting, dark urine, light-colored stools, stomach pain, or yellowing of the eyes or skin. When taking leflunomide, it's important to let your doctor know if you have any allergies to this medication or any other similar drugs. It's also important to inform your doctor about your medical history, especially if you have any immune system disorders, infections, cancer, kidney or liver disease, alcohol abuse, or heart and lung diseases. Leflunomide can make you feel dizzy, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you can do so safely. You should also avoid alcoholic beverages and talk to your doctor if you are using marijuana. Using alcohol with this medication may also cause liver disease. You should not have vaccinations without your doctor's consent, and should avoid contact with people who have recently received oral polio vaccine or flu vaccine inhaled through the nose. This medication can make you more susceptible to infections or worsen current infections. It's important to stay away from people with contagious infections such as chickenpox, COVID-19, measles, and the flu. Leflunomide should not be used during pregnancy as it may harm an unborn baby. Women of childbearing age must have a negative pregnancy test before starting this medication, and both men and women must use effective forms of birth control while taking this medication. It's also not known whether this medication affects sperm, so men wishing to father a child should consider stopping the medication and using another drug to help this one leave the body before attempting to father a child. This medication can also pass into breast milk, so breastfeeding is not recommended while using this drug. When taking leflunomide, it's important to be aware of potential drug interactions. Certain medications can change how leflunomide works or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription drugs, over-the-counter medications, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with leflunomide include warfarin, drugs affecting the liver, such as methotrexate, cholestyramine, and other drugs that weaken the immune system, such as tacrolimus, cyclosporin. It's also important to note that teriflunomide, which is used to treat multiple sclerosis, is very similar to leflunomide, so it's essential not to take it while you are taking leflunomide. Always consult with your doctor or pharmacist before starting any new medication and discuss any concerns or potential interactions. If someone has taken too much leflunomide and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. It's important not to share leflunomide with others. Before starting this medication, a skin test to check for tuberculosis should be performed. While taking leflunomide, you will need to have lab and/or medical tests done, such as liver function, blood counts, and blood pressure. It's crucial to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next one at your regular time. Do not take a double dose to make up for the missed one. Make sure to store leflunomide at room temperature and away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need it or when it's expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.